Good day everyone, we are Group 8 and today we would like to present Case Study 8.
A 35-year-old man with no medical history emerged with extreme abdominal pain and diarrhea on several occasions. He had a 3-day fever and vomited. On his first visit, he was diagnosed with possible gastroenteritis and counseled on symptom management and self-isolation. On the second visit, he was informed that his symptoms were consistent with a viral infection and was discharged with medication. Renal colic was suspected after he visited for the third time with increasing abdominal pain. Further questioning showed that the patient had a history of sore throat and dry cough. The C-reactive protein level was slightly elevated. The patient was then admitted to the infectious disease ward. The treatment was started for possible bacterial pneumonia. CT of the kidney, ureter and bladder reported no abnormalities. However, CT of the thorax revealed multifocal bilateral peripheral areas of consolidation consistent with COVID-19 infection. As a result, a nasopharyngeal swab for severe acute respiratory syndrome coronavirus 2 was submitted to the laboratory and the swab returned negative by PCR. Second day of his admission, he experienced respiratory complication and was moved to the intensive care unit. Sputum samples were submitted as the next step in the SARS coronavirus 2 investigation and it was detected positive. He recovered on the intensive care unit without the need of intubation and was moved back to the infectious disease ward after 48 hours. He had loose stools that tested negative for Clostridium difficile and other pathogens. Yersinia enterocolitica was detected in his sputum culture. He then recovered after receiving compassionate care and treatment with piperacillin tazobactam. On the 9th day of his hospitalization, he was discharged. His bilirubin and ALP levels remained normal during his hospital admission, but his ALT level was elevated. The table shows the patient blood result during admission.
Signs and symptoms.
As we can see here, the patient exhibits signs and symptoms such as extreme abdominal pain, vomited, 3-day fever, diarrhea, sore throat, dry cough, and respiratory complications. What is abdominal pain? Abdominal pain is referred to pain that can be felt in the area between the chest and groin or referred to stomach or belly region. There are many factors that could attribute to this condition, but the most common main cause are infection, obstruction, intestinal disorder, and abnormal growth of the abdomen. Next, vomit is referred to matter from stomach that has come up into and may be ejected beyond the mouth due to the act of vomiting. Vomiting usually caused by bacteria or viral infection, appendicitis, acid reflux or GERD, and gallstone. A person is considered to have a fever when he or she has a measured temperature of 38 degrees Celsius or greater, or feels warm to the touch, or give a history of feeling feverish. Fever also could be differentiated into acute, subacute, or chronic by looking at the duration. Acute fever lasts for less than 7 days, subacute fever lasts for up to 14 days, and chronic or persistent fever lasts for over 14 days. Fever could be categorized into 4 types, which are a low-grade fever that happens when the body temperature rises to 38 degrees Celsius, moderate fever that occurs if the temperature rises above 39.1 until 40 degrees Celsius. High-grade fever indicates if the body temperature is 39.4 degrees Celsius or above. And lastly, hyperpyrexia, which occurs if the temperature is above 41.1 degrees Celsius. The cause for fever are differ based on the duration, where acute fever usually caused by infectious disease such as malaria and viral-related upper respiratory tract infection. Subacute fever commonly caused by typhoid fever and intra-abdominal abscess. Chronic bacterial infections such as tuberculosis, viral infection like HIV, cancer, and connective tissue disease are the common cause for chronic or persistent fever. Next, diarrhea is categorized by loose, watery stools or a frequent need to have a bowel movement. It can be either acute or chronic. For acute, it would last for 1 to 2 days, while for chronic, it will last for at least 4 weeks. The cause for diarrhea are bacterial, parasitic or viral infection, a food intolerance, food allergy, and gallbladder or stomach surgery. Sore throat is referred to pain, scratchiness, or irritations of the throat that often worsen when you swallow. Bacterial or viral infections, dryness, gastroesophageal reflux disease, and muscle strain are the common cause for sore throat. After that, dry cough is referred to a cough that doesn't bring up mucus. It may feel like having a tickle in the back of throat triggering the cough reflex, giving a hacking cough. Hacking cough is a short, dry, and frequent cough. Dry cough are often difficult to manage and may present in long fits. Main causes for dry cough are upper respiratory infections, gastroesophageal reflux disease, and environmental irritants. Lastly, respiratory complications is referred to a secondary disease or condition affecting the respiratory system, aggravating an already existing one that happened due to disease that affect the lung, including pneumonia, pulmonary embolism, COVID-19, damage to the tissue and ribs around the lungs, and condition that affect the nerve, also muscle that control breathing.
Lab findings.
Next is a lab findings. First, white blood cell including neutrophil and lymphocytes are still in normal range blood count. Next, elevated of C-reactive protein due to the inflammatory occurring at abdominal because of the viral infection and the bacterial infection. Furthermore, elevated of ferritin due to iron stored too much in the body patient caused by Yersinia enterocolytica, which lacks sophisticated iron metabolism pathway. Moreover, elevated of LDH. LDH plays a role important in cellular respiration, the process by which glucose from food is converted into usable energy for our cells. Since LDH is present in lungs tissue, patients who diagnose viral infections can be expected to release greater amount of LDH in the circulation, as a severe form of interstitial pneumonia, often evolving into acute respiratory distress in the hallmark of the disease. Last, ALT increased due to the piperacillin tazobactam, which caused ALT to be released into the bloodstream. It is a useful marker of hepatocellular injury where very high levels of ALT can indicate liver problems. ALT is not elevated because it is particularly concentrated in the bile duct and bone tissues. It's often raised in the liver pathology due to increased synthesis in response to cholestasis, while bilirubin is not elevated because it usually normal or slightly elevated until cirrhosis becomes far advanced.
Differential diagnosis. Gastroenteritis, also known as infectious diarrhea and gastro, which is inflammation of the gastrointestinal tract. The most common symptoms include diarrhea and abdominal pain. In addition, fever, vomiting, and dehydration may also occur. The most common cause of gastroenteritis is a viral or bacterial infection. Based on our case study, in the first day, the patient has the symptoms of extreme abdominal pain and diarrhea on several occasions. In addition, he also has fever and vomit. The patient is suspected as possible gastroenteritis because the symptoms that he is facing are the main symptoms and additional symptoms of gastroenteritis. In the third day, after symptom management by medication, his abdominal pain does not resolve and become more severe. From the symptom of increasing abdominal pain, he was suspected as possible renal colic. This is because renal colic is a type of abdominal pain commonly caused by obstruction of ureter from dislodged kidney stone. So, he is generally suspected that stone obstruction in the ureter to cause pain. However, when further questioning, he has history of sore throat and dry cough. In addition, he has slightly elevated value in CRP. CRP level is generally used to check for inflammation in the body. Inflammation can be caused by infection, injury, or chronic disease. Since the patient has history of sore throat and dry cough in these few days, he is most probably occurring infection. Hence, he is also suspected as possible bacterial pneumonia. Next, his previous symptom was consistent with a viral infection which indicate he is possible infected by virus. In addition, his CT scan of the thorax revealed multifocal bilateral peripheral area of consolidation which consistent with COVID-19 infections. Hence, he is suspected to have possible COVID-19 viral infection. So, there are 4 possible diseases in this patient. First, let's look at the possible gastroenteritis. The patient's stool are test negative for Clostridium difficile and other pathogen. Logically, negative result in stool sample should be interpreted as no gastrointestinal infection. However, there are some studies argue that this interpretation may be not reliable. The first point that argued this interpretation is based on the study of Duffery and Lister 2014, which claimed that a stool sample should be collected within 48 hours of the onset of diarrhea symptom, as the chance of identifying pathogen decrease once the acute phase of the illness has passed. In our case study, the patient's stool sample was not collected within 48 hours. The second point is specimen should be obtained at the first sign of diarrhea rather than waiting for subsequent episode of diarrhea to occur. The patient in our case study was not collected the stool sample at the first sign. Besides that, the research of Sunita 2014 concluded that conventional direct plating method was not useful for Yersinia enterocolytica isolation. In addition, there is another research claim that traditional culture method was time-consuming and less efficient, possibly contributing to a low incidence of Yersiniosis. Hence, based on this statement, we would like to suggest a further investigation can be carried out by using higher sensitive methods such as RT-PCR in stool bacterial detection and identification to provide more reliable results. Hence, based on those scientific research, we would like to keep suspect that this patient is possible gastroenteritis until further investigation is carried out. Next, to check whether is he having renal colic, CT scan need to be carried out. This is to review the presence of kidney stone in his body. In his CT scan result, he showed normal CT scan for kidneys, ureter and bladder, which indicate that he doesn't have kidney stone. Hence, we can confirm that this patient does not have renal colic. Besides that, to check bacterial pneumonia, sputum culture is carried out and the results show that Yersinia enterocolitica was detected in his sputum culture. This indicate positive bacterial infection in respiratory tract system. Based on some scientific research, although Yersinia enterocolitica is pathogen that normally attack GIT organ, however, there are also some case studies shown that there's presence of extra-intestinal infection of Yersinia enterocolitica and target the lung organ to cause pneumonia. Hence, we can conclude that this patient has bacterial pneumonia. Last but not least, for the COVID-19 testing, the first nasopharyngeal swab showed negative SARS-CoV-2 by PCR. Second day, the second test of SARS-CoV-2 was detected positive in the sputum via PCR. This lab finding finally confirmed that the patient has COVID-19 viral infection. In conclusion, we can conclude that this patient has Yersinia enterocolitica and COVID-19 core infections.
Next, the diagnosis of COVID-19. To diagnose COVID-19 require the detection of SARS-CoV-2 RNA by RT-PCR. Samples commonly associated to detect SARS-CoV-2 include nasopharyngeal swab sample, sputum sample, and others. Therefore, the role of NP swab samples and sputum sample is to be used as the specimen for COVID-19 detection and commonly used to evaluate patients with suspected respiratory infection by other viruses or bacteria. This is the flow of how the diagnosis of COVID-19 is conducted. Start from the obtaining the sample to the last step, which is a result analysis. From our case study, NP swab and sputum sample from the patient has been obtained and tested via PCR. However, when an NP swab sample is used to test for COVID-19, the result appears negative. The sputum sample was then obtained and tested via PCR and turned out the patient is positive COVID-19. A false negative test like this might happen due to the patient having a low viral load during the first couple of days after they have become affected. There is also a possibility that the test result obtained by using NP swab specimen appears to be false negative due to the improper handling during sample collection or other reasons. Besides, although NP swab is known as the gold standard of obtaining specimen to detect COVID-19, it has been reported to be less effective in detecting SARS-CoV-2 compared to sputum sample, as mentioned by Albas et al.
Difference between Yersinia enterocolitica and Clostridium difficile infections.
So, what does the contrast of Yersinia enterocolitica and Clostridium difficile? Normally, the infection of Yersinia enterocolitica is due to ingestion of microorganisms of undercooked meat or direct inoculation through blood transfusion, while the infection of Clostridium difficile might due to the side effects of antibiotic prescription or weakened immune systems with previous infection of Clostridium difficile. Next, the complication of Yersinia enterocolitica might be gastrointestinal or extraintestinal. The complications included in gastrointestinal are bowel perforation, peritonitis or diffuse ulcerating colitis and colitis, while for complications included in extraintestinal are hepatic abscess, splenic abscess, septicemia, renal abscess or lung abscess, while the complications of Clostridium difficile are dehydration, kidney failure, toxic megacolon, bowel perforation, and also might cause fatality. And lastly, for the laboratory samples to detect Yersinia enterocolitica, we can use stool, blood, sputum, urine, throat swab, and bile sample. While the sample that can be used to detect Clostridium difficile are stool and blood sample.
Final diagnosis.
So, the final diagnosis of this case is co-infection COVID-19 with Yersinia enterocolitica. Since the patient is diagnosed with COVID-19, so let's see what is COVID-19. COVID-19 is a new infectious disease that caused by a newly discovered coronavirus called Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. It was first studied on 31st of December 2019, following to a report of a cluster of cases of viral pneumonia in Wuhan. This virus was first spread among people in Republic of China. The disease now has spread worldwide and leading to an ongoing pandemic as we are going through now. Current update on Google on 22nd of May 2021, the new cases is 607,681 cases, while the total cases is 166,346,635 cases worldwide. The severity of COVID-19 may vary according to the individuals. The disease may take a mild course with few or no symptoms, resembling other common upper respiratory diseases such as the common cold. But there are several risk factors that have been identified as being a cause of multiple admission to a hospital facility. The risk factor of this disease increase for an individual who are above 60 years old and also with the presence of chronic conditions such as high blood pressure, heart and lung problems, diabetes, obesity, or cancer.
Transmission of COVID-19. Transmission occurs by respiratory droplets of the infected person, direct contact by hugging or shaking hands, or contact with a contaminated surface. The infected people take an average of 5 to 6 days or up to 14 days to develop symptoms. During that time, the infected person can spread the virus to other person. The pathophysiology of COVID-19. SARS-CoV-2 infected person through respiratory droplets and aerosol from person to person. Once inside the body, SARS-CoV-2 enters the host cell by binding to ACE2 receptor with its spike protein. ACE2 receptor is the receptor for the SARS-CoV-2 virus and allows it to infect the virus. The ACE2 receptor is highly expressed in nasal epithelial cells. The disruption of ACE2 receptor causing the manifestation symptoms of fever and dry cough. In the next stage, the virus migrates into the lower respiratory tract that cause severe symptoms. The virus then invades and enters the type 2 epithelial cells via the ACE2 host receptor. Then, the virus undergo replication and produce more viral nucleocapsid. The infected pneumocytes then release many different kinds of cytokine and inflammatory markers causing a cytokine storm. The cytokine storm caused the influx of neutrophils, CD helper T cells, and CD8 cytotoxic T cells, which are responsible to fight the virus, this causing inflammation and lung injury. The persistent injury that is caused by the increase of inflammatory cells and viral replication causing diffuse alveolar damage that can lead to acute respiratory distress syndrome. Because of the virus is not detected in stool, we speculate that gastrointestinal symptoms of this patient may not be caused by the direct damage in the intestinal due to virus infection. The disorder of respiratory tract flora can impact the digestive tract through immune regulation. This effect is called the gut-lung axis. The effector CD4 T cells entering the intestinal mucosa are the key for mucosal immunity and chronic enteritis. CC chemokine receptor type 9 is a necessary chemokine receptor for CD4 T cells to enter the small intestine. The viral infection in lung cause increase in lung-derived CCR9 CD4 T cells. The small intestine epithelium can express CCR25, which promote the recruitment of CCR9 CD4 T cells into small intestine. The changes in intestinal flora then promotes the polarization of T helper 17 cells and produce interleukin-17. The excessive production of interleukin-17 will lead to recruitment of neutrophils and causing intestinal immune damage, diarrhea, and other gastrointestinal symptoms.
Next, let's see what is Yersinia enterocolitica. Yersinia enterocolitica is known as a gram-negative bacillus-shaped bacterium cause a zoonotic disease called yersiniosis. It is a foodborne pathogen causing symptoms such as fever, diarrhea, nausea, vomit, and abdominal pain. Yersinia enterocolitica is an important foodborne pathogen with worldwide distribution. Most cases are sporadic without an apparent source. During the past decades, small outbreaks have been linked to pork, salad, and milk. As mentioned in the small outbreaks just now, Yersinia enterocolitica has been identified to be transmitted through contaminated food, commonly raw or undercooked pork, direct or indirect contact with the animal, or unpasteurized milk.
Pathophysiology of Yersinia enterocolitica. The bacteria can enter the body through ingested raw food or undercooked pork. Bacteria cell infecting the small intestine at terminal ileum and proximal colon. The bacteria mainly use virulent gene product to colonize inside intestine. In body temperature, bacteria induce the expression of virulent gene PYV to secrete virulent factors. The virulent factors facilitate the binding of bacterial cells to mucosal membrane and invade M cells of Peyer's patches. Once internalized, bacteria are transported across the epithelial barrier and expelled from basolateral side of M cells. Then, macrophage phagocytes the bacteria and migrating to mesenteric lymph node. the migration causing an inflammatory response that triggers abdominal pain.
We found that this is the first case of co-infection COVID-19 with Yersinia enterocolitica, while the presentation of Yersinia enterocolitica in lungs is very rare. So, the current hypothesis regarding the gut-lung axis in the transmission of such organism has been the topics of increasing interest. This interest has also going along with the case reports of gastrointestinal pathogen infecting the lungs via microbial translocation. So, how does the bacteria infect the lungs and cause all the manifestation? Begins with the invasion and propagation of the bacteria into the lung parenchyma at the alveolar level. The invasion has triggered the body's inflammatory response to against it. This inflammatory response is the main reason for the clinical manifestation of the bacterial pneumonia. Alveolar macrophage triggers the inflammatory response to strengthen the lower respiratory tract defense. Cytokines are released and cause the constitutional symptoms. For example, interleukin-1 and tumor necrosis factor causes fever. Next, chemokine like interleukin-8 and colony-stimulating factor like granulocyte colony-stimulating factor has promoted chemotaxis and neutrophils maturation, this respectively resulting in leukocytosis on serological lab and purulent secretion. Cytokines are responsible for the leakage of the alveolar capillary membrane at the site of inflammation, causing a decrease in compliance and shortness of breath. Sometimes, even the erythrocytes would cross this barrier and result in hemoptysis. Next, let's see the mechanism of action of piperacillin-tazobactam. Piperacillin is an extended spectrum penicillin antibiotic where it kills bacteria by inhibiting the synthesis of bacterial cell walls. It binds preferentially to specific penicillin binding proteins located inside the bacterial cell wall. However, it can be destroyed by an enzyme produced by the bacteria called beta-lactamase. Meanwhile, tazobactam inhibits the beta-lactamase and prevents the destruction of piperacillin. Therefore, tazobactam is given with piperacillin to enhance the activity of piperacillin in eradicating bacterial infections. Plus, this combination is used to treat a variety of bacterial infections, including pneumonia, as suffered by this patient. He then recovered after receiving compassionate care and treatment with piperacillin-tazobactam.
Treatment and management.
Treatment and management. For the treatment of COVID-19, other than medical treatments provided by hospital, the person himself must wear a medical mask everywhere he goes and also clean hands frequently. Plus, he must keep a 1 meter distance from others and also have to monitor any symptoms for 14 days if he is suspected with COVID-19. For the medical treatment, they will give a supportive care including oxygen for severely ill patients or those who are at risk. Plus, respiratory supports such as ventilation also will be given to patients who are critically ill. Apart from that, dexamethasone also help reduce the length of time on a ventilator. However, for antibiotics, it only used to treat secondary bacterial infection. As for the management of COVID-19, the government also plays a big role where they need to have the enforcement of health screening in all points of entry. Plus, isolating or quarantine infected individuals and social distancing are important to stop the spreading of virus. Apart from that, is to increase the number of hospitals to treat COVID-19 cases. They also need to urge public to wear masks, frequent hand wash, and avoid mass gathering, other than conduct disinfection activities regularly. For the medical management, strict hand washing and respiratory hygiene must be done, and also to tell the patients to cover nose and mouth when coughing or sneezing. They also need to perform hand hygiene after contact with respiratory secretion. Patients must be placed in properly ventilated single room. Apart from that, waste management, environmental cleaning, and sterilization of equipment must be safely done, other than clean and disinfect patient contact surfaces regularly. For the treatment of Yersiniosis, most people will recover without treatment. Treatment for Yersiniosis usually involve treating the symptoms only. For example, person with diarrhea should drink lots of liquids to avoid dehydration. More severe or complicated cases may require antibiotic. But for this patient, in this case, piperacillin tazobactam were given to him due to bacterial pneumonia. For the preventions, always keep food preparation areas clean and always wash cutting boards, countertops, cutlery and utensils after handling uncooked pork. Raw fruits and vegetables also must be washed before eating. Plus, raw pork and other meat must be kept separately from other foods when doing groceries. Apart from that, always wash hands and cleanse hands scrupulously with soap and water. Wash hands also after using the bathroom and changing diapers and before handling or eating any food. Plus, cook and store food at appropriate temperature and avoid eating raw or undercooked pork. The raw meat and poultry must be cooked thoroughly to destroy the bacteria. And lastly, food must be stored in refrigerator that is 40 degrees Fahrenheit or cooler or a freezer that is 0 degrees Fahrenheit or cooler. That's all from us. Thank you.